Hi, hello, and welcome to my presentation on congenital adrenal hyperplasia. My name is Diana Theodore. Okay, so the main reason why we have this disease is because of hydroxylase deficiency, and congenital means it's discovered at birth. This is something people notice at birth, and that's why babies are tested for it. It affects the adrenals, and hyperplasia means the adrenals are enlarged, okay? And there are different types. You have the classic saltwater wasting, which accounts for 75% of all cases, and that is the most severe and dangerous form. The classic simple virilizing is less severe and it's less dangerous, and it affects 25% of people, with 1 in 60,000. Non-classic, which some people might not even really notice symptoms until much later in life, and usually teenagers or adults can get tested for it, not babies. And it is caused by the CYP21A2 gene mutation, which produces different phenotypes that we'll talk about. So aldosterone and cortisol are two hormones produced by the adrenal glands, and cortisol is responsible for stress response. If we have too much or too little, it can affect high blood pressure, fluid retention, and blood sugar levels. Okay, so 21-hydroxylase will synthesize both of these hormones. Okay, the most severe one is salt wasting, where the body cannot retain water. Water just passes throughout in the urine or vomit. In the less severe form, we have elevated levels of androgen. So in the severe form, androgen levels are too low, and you'll have low blood pressure because of the low fluid volume in the body. The body cannot hold on to water. And when you have hormonal imbalances like that, because of the androgens, sometimes you'll have too much testosterone being produced as well. And the testosterone usually affects women more than men. And we'll talk about it as well. And for the guys, it's not too bad, but for the women, it's really detrimental to their appearance and their genitals. Okay, so here is the kidneys. The adrenals sit on top of the kidneys. They are about the size of a walnut. And with hyperplasia, they might become enlarged, okay? Because of the two hormones, aldosterone and cortisol. The targets, who gets it? Well, men and women both have an equal chance of getting congenital adrenal hyperplasia. The disease affects about 10,000 to 15,000 newborns every year, and that is in the United States of America, okay? And probably Europe. The most severe forms affect Europeans or Caucasians, and I mean, everybody has a chance to get it. People of different races have a chance to get it, but Europeans get it the worst severe, classical form. And the milder forms are usually had by the Ashkenazi Jews. And as we know about consanguineous marriages, when people have bloodlines that are very similar, like marrying first cousins or second cousins or sisters and brothers, they have a higher likelihood of getting that because it's autosomal recessive, and you need one copy from each parent. Okay, female symptoms. So for women, because they have more androgens and more testosterone in their body, they will have abnormal menstrual cycles. They'll have deeper voices. They have early appearance of pubic hair, and that pubic hair could be all over their body, under their arms, and they have more facial hair as well. They'll have ambiguous genitalia, as you can see here in this picture. So this is the clitoris, and this almost looks like a boy's body part because this is fused. They'll have late periods and polycystic ovarian syndrome because of excess male hormones. Okay, so this is what it looks like. So this is what a normal woman would look like, with the vulva, the opening here. But these are the degrees of virilization. So the worse it gets, the more her body is a girl because she does have a uterus, an ovary. She has a womb. They might be hermaphrodites, but the more severe it gets, she has a penis. The clitoris becomes so big, it looks like a penis, a small penis, and this is closed. So this opening here is closed. It's fused together, but inside she has all the plumbing of a regular woman. She has a uterus, but and fertility is impaired. It's very hard for them to get pregnant unless it's early stage. Okay, men. So men don't really get it as bad. Okay. So they have early appearance of pubic hair, the penis, scrotum, and prostate will become enlarged. Some guys might like that. Unfortunately, the testicles will be smaller in comparison to the penis. And they could get non-cancerous testicular tumors. So they might not be cancerous, but they'll get tumors in the testicles because of all the extra hormones, okay? And oligospermia or low sperm count. Again, that's because of the hormones and the adrenals, okay, affected. Okay, general symptoms besides puberty and other things. So the classical, this one is life-threatening because the body cannot hold on to water. There's not enough cortisol and aldosterone, so the body can't hold on to water. The water just comes out through the urine, and it causes severe dehydration, especially in babies. Okay, and yeah, it can cause problems with blood pressure and sugar, as we talked about. Fertility issues, as you can see, for women and men have low sperm count. Women might have problems with their genital organs, so that causes severe fertility issues. They have bad acne, and the growth is interesting because it affects the skeletons, the skeletal system, so they grow quickly, but at the same time, when they hit puberty, when they hit adulthood, that fast growth spurt does not equate with the final height. Like, why? It grew so quickly, but they're not as tall. Okay, genotypes. Okay, so as I talked about, it's autosomal recessive. So it skips generations, and some people might not even know that they have it unless they have children, if that thing, because their parents might not have it. People could be carriers. So the carriers, the one carrier marries another carrier. If a carrier marries somebody who doesn't have it, they're okay. If a carrier marries another carrier, as we can see there, 25% of the children will be affected, 25% will be okay, and 50% will be carriers. So there's 25% chance that the children will have it, okay? Because they need 2 copies of the genes. That is why in consanguineous marriages, they have a higher likelihood that the children could get this. Okay, here's my pedigree chart explaining. So as you can see here, the great grandparents, one is a carrier, one doesn't have it, so it's recessive. So neither of them have it, but it shows up in the next generation. So they have 4 children. Okay, 2 of the children are carriers, 1 doesn't have it, and 1 has it. So 1 carrier married one who has congenital adrenal hyperplasia, and they have 4 children. 2 are carriers, 1 doesn't have it, and 1 has it. The one who has it has a severe salt wasting form. And we have the son who's a carrier married someone who doesn't have it, and they have a child who's a carrier. So this describes how it works out. So there's a 25% chance the children will get it, and 50% chance they'll be carriers, and it skips generations. Testing, so they can get the 17-hydroxyprogesterone test, or 17-OHP, okay? And it's a hormonal test on the glands. They can test the levels in the blood if it's too high or a certain level. The treatment, and it's routine now. It's mandatory for children in the US. Okay, so it will be taken a couple days after the baby is born, and then the doctors will know what to do from there. There'll be referrals from pediatricians or endocrinologists or obstetricians. So you also have non-invasive treatments that can happen too as well. And this can happen within the first 7 to 8 weeks of pregnancy to test if the parents think they might have it. They will test the amniotic fluid so they can prepare for the child and know what to expect. And then we can also have a prenatal diagnosis offered to parents who are carriers. And for that to happen, because usually it's congenital, it happens when the baby is born, they see something. So for that to happen, parents need to probably have somebody in your family who has it. Treatments. So hypertension can be treated with glucocorticoid treatments. So glucocorticoids helps, and sometimes they might need double or triple diagnosis if they have stress or surgery. So another treatments they might have, people with salt wasting with the aldosterone deficiency require mineral corticoid replacement. And infants, like little babies, will have high mineral corticoid requirements in the first few months to get them back to normal, because babies will be super dehydrated, and if they can't maintain water and blood pressure, they will die. This is a fatal disease. Treatment free, people will need surgical operations, like we talk about the women, okay? So even between babies, between 4 and 12 months, you'll need to fix, because the vulva is fused. So before the baby gets even older and things, and your muscles and tissues will get, firm, they need to have surgery to fix it so they can grow into it, okay? So your clitoromegaly is when they had a big clitoris that looks like a penis. You need to reduce that. And vaginoplasty as well, because they have the inside organs, just the external. Looks like a man. Oh boy. And these are my references, and I want to say thank you for listening to my presentation. Thank you so much.